Hello friends, I am Dr. Priyadarsh. I am working in Shahid Hospital in Chhattisgarh and I am also volunteering for Yumetta Foundation. I am going to share my observation while working in the COVID care center in our hospital and also what response we are planning to do. So the observations are that people are still not knowing about COVID completely. Then the people are scared to do COVID testing. They don't know the symptoms of COVID. They are still unaware about the danger signs and symptoms about COVID, and then they should get immediate referred to the hospital. So we are also seeing many misinformation in social media about detection, about home isolation, and also about vaccination. The second thing we want to talk is about the suspected COVID patients. So the COVID testing with antigen or RT-PCR, so there is delay in reports after RT-PCR, and in the antigen some people are doing testing, but then the reports sometimes are false negative. So those patients don't take much care of themselves, and then they land up in a very deteriorated state in the hospital. So those patients who are coming to our hospital are reaching either on 5th day or 7th day from the starting of symptoms, and their saturation is very less, like 70 or 60. So once the saturation is below 80%, it is very hard to save their life at our hospital setup or at any hospital setup. There is also phenomena called silent hypoxia or happy hypoxia, in which the patient will have COVID, the condition of the patient will deteriorate, the oxygen saturation will drop, but the patient will not feel any symptoms till the saturation drops below 85% or 80%. So this is happening in many places, in especially the people who had not done their COVID testing, or the people who are home isolated but having all the COVID symptoms, and then when they reach to our hospital, their saturation is already below 70 or 80, and then it's become more hard for us to do proper treatment on them. So what we are seeing is that there is a rush of help and in making COVID care centers at big cities. There is rush to provide ventilators, oxygen concentrators and other thing. But still, people are forgetting that 60% of Indian population lives in villages where there is no proper referral, there are transport problems, there is no proper chain or proper detection facilities, and the people are misinformed. So many deaths are happening among the suspected people who are not yet COVID positive, who are not yet labeled tested COVID positive, and then we are missing all these deaths, and then there is very much under reporting of the deaths. So the response we are planning is, the first one is we are going to start a call center which will be dedicated to COVID, and which will have volunteers from all over India, also region specific volunteers for any language specification, and these volunteers will be trained in various aspects like counseling and information about COVID and vaccination and when to get referred, and these volunteers will be helped and backed up by doctors in the ratio of 15 volunteers to 1 doctor. So any problem which the volunteers cannot handle, the call will be forwarded to the doctor, and the doctor will take care of the caller who is in distress. The second thing we are advocating is village-based oxygen saturation monitoring. So if the ASHA or Anganwadi or any village health worker can be given pulse oximeter at the village level, and she or he will monitor the oxygen saturation of all the home isolated COVID positive patients, all the patients who are tested COVID negative but have symptoms, and all the patients who are yet to test for COVID antigen or RT-PCR but still have symptoms. So in all these three category, if the ASHA or any village health worker start examining the oxygen saturation of the patients, we might catch the deterioration in any patient. Once the oxygen falls below 90 or 94, we can make immediate referral of the patient for to the facility where oxygen is available. So saving this patient is very likely, because they are referred timely, and then it will also reduce burden on tertiary care facilities. The third one is that we are trying to help the community level community level COVID isolation center or COVID care centers with with some equipments. The fourth one is that we are trying to collaborate with the government and non-government organizations, NGOs, and then we can train their volunteers for different aspects of COVID and counseling, and then with collaboration with the government and non-government agencies, we can actually make things happen, because no single person, single agency can respond this crisis in this time. So this is what we are going to offer. We can help with the call center technology to any government or non-government agency. We can help with training of their on-field volunteers, and we can help in establishing COVID care centers or isolation facility with some equipments, and we can help in the collaboration of government and non-government agencies. So we'll be sharing this toll-free number with you. Please stay safe and stay healthy. Thank you.